It is not uncommon that some babies develop yellow discoloration in their eyes a few days after birth. This is called jaundice in the newborn. Many parents notice yellowness first in the eyes and then over the face and are overly concerned about this problem. Although many newborn babies who have jaundice can be observed with no active intervention, some newborn babies may need treatment. Jaundice in the newborn baby can be caused by a number of causes. Therefore, it is important that your baby is seen either by the public health midwife or the baby's doctor to determine the best course of action. Let us understand some important facts regarding jaundice in your newborn baby. Newborn babies have high number of red blood cells in their blood, which are broken down and replaced frequently. Breakdown of these red cells lead to production of a substance called bilirubin. Excess bilirubin is handled by the newborn's liver. However, in a newborn baby, the liver is not fully developed, so it is less effective at processing the bilirubin and removing it from the blood. When blood levels of bilirubin go up, it gets deposited in skin and eyes and the baby starts appearing yellowish. By the time a baby is around 2 weeks old, bilirubin production goes down and the liver develops the ability to clear bilirubin more effectively. This means that jaundice often corrects itself in most babies without causing any harm by the time they are 10 to 14 days old. Approximately 70% of the term babies and 80% of prematurely born babies develop some amount of jaundice, but only around 10% of them require medical intervention. In most babies, the jaundice happens due to immaturity of the liver, and this is called physiological jaundice. Many newborn babies have jaundice that does not need any treatment. However, when bilirubin in blood is too high, excess bilirubin can enter the newborn baby's brain and this can potentially result in brain damage. Therefore, it is very important to differentiate the harmless jaundice from the jaundice that can adversely affect the newborn baby's brain. Certain risk factors increase the chance that jaundice becomes severe, needing timely treatment. Therefore, assessment by a clinician whenever you are concerned about jaundice becomes a vital step. Some of these risk factors include the jaundice that develops within first 24 hours of birth, mother's blood group being either O or rhesus negative, family history of severe jaundice in a previous infant, jaundice that spreads down the entire body, and persistent jaundice that lasts beyond 3 weeks in association with pale colored stools. A newborn with signs of an infection such as vomiting, poor feeding, fever or low temperature, fast breathing or poor breathing effort can also develop very high bilirubin levels that can potentially result in brain damage. Therefore, it is very important that your baby is brought to the attention of a pediatrician without delay in the presence of these risk factors. Although breastfeeding your baby can increase their chances of developing jaundice, it is a vital step that you continue to breastfeed as effectively as possible. This is due to the presence of a number of vital benefits of well-established breastfeeding that definitely outweighs any risk that it causes jaundice in the newborn baby. Breastfeeding-related jaundice settles in most babies within the first few weeks of life without needing any intervention. Once your baby is seen by the doctor and appears to have little jaundice from the clinical visual assessment, the doctor will simply advise you to follow up after a few days. However, if your baby is deeply jaundiced or has jaundice that lasts beyond 2 weeks of age, the doctor may decide to perform one or more investigations. The severity of jaundice is checked using a blood test called serum bilirubin. If bilirubin levels are concerningly high, the doctor may decide on the need to perform other investigations on your baby on as required basis. Phototherapy is the most common treatment given for jaundice seen in newborn babies. It is a special bright light that is applied on your baby. It helps with breakdown of bilirubin present in their skin so that it can be passed in their stools. It is recommended that your baby's eyes are kept well covered using eye shields to protect the eyes from bright overhead lights while receiving phototherapy. Rarely, the pediatrician may recommend to perform an exchange blood transfusion in very severe degrees of jaundice. This procedure is performed in an intensive care unit dedicated for caring of newborn babies. Most babies with mild jaundice do not need any treatment. However, newborns with severe jaundice and persistent jaundice need follow-up to make sure that jaundice is completely resolved. For newborn babies who recovered from very severe jaundice, the pediatrician will recommend to perform hearing assessment on a later date as high bilirubin levels can cause hearing impairment.